Hey Carter, I'm Dr. Karen. Thank you very much for writing in, and that is a really excellent question. Urinary incontinence isn't uncommon in geriatric female dogs, but it can also be an unfortunate consequence of spaying, particularly in larger breeds when they're spayed at a younger age. There's still loads of debate about how, when, and at what age we should spay dogs of different breeds. So what might be recommended one day could change the next, which is really frustrating both for vets and for dog owners. It can be particularly difficult when trying to strike a balance between managing a condition and avoiding the side effects of medication, particularly when, like in Lexi's case, the problem has started at such a young age. So, the risks of being on a medication for a few months or a few years are very different to being on them for an entire life. So, the two main types of medications used to manage urinary incontinence in female dogs are estrogen therapy, a bit like HRT in women, and sympathomimetics, which is a smooth muscle stimulant that sort of acts on the smooth muscle around the urethral sphincter. And like any medication that has a measurable physiological effect, they also have side effects. The more common side effect of the sympathomimetics include tachycardia, which is an increased heart rate, and hypertension or high blood pressure. And that can also lead to an increase in urine protein levels, which can then have a knock-on effect to damaging the renal tubules or leading to some kidney damage. There are some more rare side effects, which I'll go into in more detail in my written answer, but they aren't very common. In the case of estrogen therapy, there is an increased risk of tumour development in organs where estrogen receptors are present, so like the mammary glands. So dogs that have been spayed may still develop mammary tumours, especially if they are on estrogen type of therapy. So each case is different, and some dogs may need a combination of both medications to really achieve good control of that urinary incontinence, while others won't respond to either medication at all. Another issue that can complicate things is that urinary incontinence is often associated with an increased risk of urinary tract infection, because as the sphincter that allows urine to leak, it also can allow bacteria in. So regular checks of the urine are a really good idea. There are also several anatomical conditions that can cause urinary incontinence, so it's really important to rule those out as well. So imaging with contrast, ultrasound, these are often necessary to make sure that we are treating the right thing with the appropriate medication. In more severe cases, surgical treatments are an option to manage urinary incontinence in dogs, but it's a pretty big step and it's not always successful. And there has been some recent success with using collagen injections in the area to actually sort of add bulk to the tissue surrounding the urethra, but this is still in pretty early days. So ultimately, the best way to achieve a good balance between therapeutic effect and minimizing the risks is to work closely with your vet. You need to titrate Lexi's medication so that we're getting the minimum effective dose and having regular checkups to monitor her blood pressure and her urine. So things that you can be doing to reduce the dose that is needed to manage her incontinence are things like increasing her access to the toilet, either by having a dog door or just by taking her out more frequently. That's going to reduce the size of her bladder and therefore reduce the pressure on her urethral sphincter. Hopefully, this helps you strike that balance between risk management. And if you'd like to discuss this in a little bit more detail, you can always head to pangovet.com. and you can have a one-on-one online appointment with one of the vets there. I've also included some links to a bit more reading for you at the bottom. Take care.